I'm Dr. Rudy Kasha, and if you're watching this video, then you're either just trying to get some more information, or you're maybe considering coming in to seeing me for a consult for a brachioplasty. So that's an arm lift. So we're going to talk about that today. I'll give you some information, just so you have some background and some information so you can ask some questions if you have anything specific. But basically, with a brachioplasty or an upper arm lift, it's a pretty straightforward, simple surgery of removing extra skin and a little bit of extra fatty tissue. So it's not something when there's lots of fatty tissue. We either need to lose some of that first, or sometimes we do some liposuction, even sometimes in a staged fashion, and then come back and do the brachioplasty. But it's removing extra skin from sometimes just, I guess the main thing really is after someone that's lost quite a bit of weight. Sometimes it can happen just throughout life as the skin loses some of its elasticity. And then we remove that skin. It's definitely a procedure where I have a conversation back and forth about pros and cons. Is it worth it? Is it right for you? It's one of my least favorite scars. So as a plastic surgeon, everything we do, we're removing things, tightening things, and we're leaving someone with scars. And for the most part, all that goes quite well, or they're in hidden areas so that it's not as pronounced. But a brachioplasty is a fairly prominent scar. And it's really important for you to consider, and then for us to talk about whether the trade-off of that scar is worth it or not. So that scar basically goes from the armpit all the way down just slightly past the elbow. It stays kind of on the inside part so that when your arm's down, you don't see it at all. But when you're moving your arms and things, you do see the scar. Sometimes it heals decently or even well, but I will say there's a lot of times it doesn't, because usually it's in a person that has lost a fair amount of weight, and so their skin, the deeper layer, there's two main layers, the epidermis and then the dermis. That dermis is thinner, and so that dermis itself is what keeps a tissue together, keeps the scar together. But when the dermis is really thin, which is most of the time the case in this scenario, even though we're putting that together with suture, that dermis separates back out and you get kind of a spread scar. It's kind of the same concept of what's happening in a stretch mark. And so for the most part, this scar is fairly visible. So in that case, if someone comes in to me and says, hey, I want a brachioplasty or an arm lift because I don't wear sleeveless shirts and I want to be able to wear sleeveless shirts, then my first thing is, well, hold on. You might not wear sleeveless shirts for a whole other reason now after this. You won't have any extra skin. You'll have an awesome arm shape, but that scar will be noticeable and it may deter you from wearing sleeveless shirts then. So it's kind of all a balancing act. So if you have tons of extra skin, you've lost quite a bit of weight, and then that fullness is gone, but you can't get rid of the skin with any other way than surgery, then it's probably going to be worth it. It's going to be worth the scar. You're going to feel a ton better. It'll look tons better in clothes, and it potentially may even seem a better trade-off even when you've got, say, short sleeves on, and where you'd rather see the scar than that extra skin. If it's someone that's just coming in and just with typical aging that happens, the skin loses some of its elasticity and there's a little bit of extra there, then that's the person where I really caution them that, hey, I don't know if you'll feel that after the fact this was worth it or not. So that's a big part of something to consider with a brachioplasty. I'd say that's the main thing in your decision point. But other than that, straightforward surgery. We have our own surgery center where you would have this done in that case. Sometimes it's even done under IV sedation, but a lot of times under general anesthesia with a board-certified anesthesiologist. It takes about roughly 2 hours to do the surgery. And like I said, that's an incision from here to here. We go in there, we take that skin, we do take some of the fatty tissue out as well. We do some liposuction around here so that shapes everything much nicer. And then we close all that up with sutures that are all underneath the surface and all dissolve. Just like any surgery, there's risks, bleeding, infection, all of that kind of stuff. But some key things here is to know that very real risk of a poor scar. That's one thing. There are lymphatics in your arms. That's that kind of clear fluid in your body. We're very careful to stay away from those, but sometimes there's a risk of affecting those and you could potentially have some swelling in your arm. That's called lymphedema. It's not common, but it is something to know. There are obviously very important nerves in your arm, both nerves that supply sensation. That one's very superficial, and there's a few occasions where you could have some numbness in your lower arm that could be temporary or permanent. But there's also deeper nerves that actually move the hand. Extremely important, obviously. Should be totally fine, not really something I'm worried about. We know the anatomy for that and we're away from that. But it is something to know just that there could be extreme scenarios if that nerve was taking a strange course or something where someone could have an injury to that nerve and have significant consequences. Once again, extraordinarily rare. Don't expect to see that, but it's still important that you're well informed of that. And then there's a full list that you'll get with surgery that explains all the kind of risks that can happen, so it's important to review over that. I expect this to go great, but it's still important to be fully informed before you make your decision. So after surgery, spend some time in the recovery room, you go home, you come back and see me 1 to 2 days after surgery, and then at some other set points along the way. You'll have some ACE wraps on your arms at first. I always tell everybody before surgery, go get some of those runner sleeves, either a sporting goods store or something like that. They can go from here to up here, or you can go online. There's some compression websites where you can go to, and they actually have some that come around the top of the back here, and they're totally open here, but they come around the top of the back and then they start here and go down the arm. That way there's no crease in the armpit and they don't tend to slide down. So that's a very helpful type of compression garment for this type of surgery. We tend to keep you in that about 4 to 6 weeks. Gets the swelling down, that sort of thing. Scar gel, like biocorneum, which we sell at the office, is a great thing for this scar. We try to do everything we can for this scar. Silicone tape is also helpful, like Scar Away. You can even get that on Amazon. But those are things that help with that as well. You may have a little swelling at first, not really much pain with this type of surgery. It's just a skin-only surgery. There's still restrictions, nothing extreme, but you're still trying to be careful because you just don't want to pull on that scar and do a lot of stuff with your arms that could promote spreading of that scar anymore. Most people, a few days off of work, something like that. It really just depends what you do for work, but it's a pretty easy to recover from surgery. But that's kind of the basics of a brachioplasty or an upper arm lift. Hopefully that helps give you some ideas. The key thing, like I said, considerations of the scar. So that's the big thing we'll talk about. Is this right for you? Is this a worthwhile trade-off? So hopefully that helps, and I look forward to meeting you.